All right, here we go. Dr. Tami, go ahead.
Everyone's so excited because we have a stem cell documentary series that's going to be released on January 16th. It is going to help understand and help create the awareness of what on earth is a stem cell, and do you have to go to Panama? Is it from dead babies? You know, what is stem cells, and what good can it do you? It talks about all the different kinds of stem cell therapies available, and that you can get it right here in the United States. My clinic, Seattle Stem Cell Center, is one of the largest in the nation. People fly from all over the world, Korea, Taiwan, Europe, and then of course all over the United States. So the good news about this documentary series, and we're going to watch a little clip of it, is that it's going to be for free. So you're going to get to watch the documentary series for free for 2 weeks. But if you'd like to be part of the movement, if you would like to help spread the word, because, can you imagine, are we getting help from Big Pharma?
No.
No. Are we getting help from the FDA?
No.
No. So this is a grassroots effort to help people understand that the treatment for MS, Parkinson's, autoimmune conditions, lung conditions, heart, pain, nerve pain, joints, all of these things and more can be treated. Plus, you can just simply bank your cells for the future and have the ultimate bioinsurance. So we need everyone's help to spread the word, and what better way than offering everyone in your network, all of your friends and family, the opportunity to see a documentary series for free. Now the good news is after 2 weeks it's going to be a paid video series, so if people want to own it and watch it over and over, if they only got to watch a part of it and they want to purchase it, if you are an affiliate and you bring the people in, you receive 50% commission as if you are a marketing or salesperson, but it's not sales, it's just information. And so you actually can benefit from spreading the word both personally, but more importantly, you'll be impacting people's lives. And then we've been approached. The film has been produced by an Emmy Award-winning filmmaker, Jeff Hayes, and he was up for a Grammy. He's just an amazing filmmaker, and he dedicates his life now to only doing films that make a difference. And so he's been approached by Netflix. So the opportunity for us to get in on this way to spread the word, and really, you can tell I just get all excited because I really want people to stop having drugs and surgery as the first option. So let's watch a little bit of the clip, and then in order for you to be part of this and to receive the commissions and to help spread the word, even if you don't want the commissions, who cares? You just want your friends and family in your network and everyone you know who knows someone who knows someone who knows someone, right? 3 degrees of separation, you might actually save someone's life. So you need to email us at support@drtami.com. That's support@drtami.com, and we'll get you a copy of this documentary series so you can spread it like wildfire. And your friends and families and network will love you for offering a free documentary series. Sweet. Sounds good. So let's see what we've got over here.
If they were having issues with that computer, we can go ahead and put it over here. Do you need live? So let's go ahead and just, if there's some issues, we'll put the right up here on these boxes.
Okay. So we'll just watch this.
Talk about those with disabilities, and us trying to do things to help them. Now, I'll be damned if we don't have the chance tonight to hear the very next bill that opens up the doors of medical science. Because I pray to God every time I close my eyes that one day my wife had the chance to have that opportunity again, to be able to walk.
It makes you feel a personal responsibility that you need to kind of fight for and bring hope to people who've basically lost hope.
What was so powerful is that we were able to all come together and pass something that will make a difference in the lives of Texans and hopefully American citizens.
I think we have laid the framework in for other states to be able to follow quickly.
Ethically, this needs to be moved forward. We realized early on that physicians really need to understand the truth about stem cells. It's not science fiction, it's biology.
One of the joys of using stem cells is there's almost always lots of upside and no downside.
In the tens of thousands of administrations that we've given, there have been no serious adverse events.
I went into practice because I wanted to help people. Not just put Band-Aids on people, but really get to the root cause and fix it. And that's exactly what this is.
Patient after patient after patient, continuing to see these miraculous changes.
She was back to training for marathons. To her, that was a miracle. To me, I wasn't surprised.
It's one of those things that are too good to be true.
Tell me why you're so emotional.
As of a month ago, he doesn't wear oxygen at all.
This is your life. This is the life of your wife or your husband, your sons, your daughters, your family members.
What does your wife think of the new you?
We go on so many dates, I don't know where to start. I'm just glad she's happy.
It is so exciting what's going on. You know, the fact that you could literally take your own stem cells and bank them and have them available.
This could benefit me, my family, and just think of the larger implications of actually helping all of the, the people that I've served with, and I see that, they're in just as much pain.
Neurological conditions, things like Parkinson's, MS, ALS, traumatic brain injury, autoimmune diseases, diabetes, lung, heart, kidney, essentially any organ or tissue inside your body that needs to have healing can be used with these cells.
It's not the fountain they use, but maybe it's some droplets from the fountain they use. You're putting these cells in that actually regrow tissue.
I played 16 years, 100 or more games a year. Since then, I've been able to speak to a lot of people, not just athletes, who have gone through this process and have had raving reviews about it.
I know the research that's going on right now, in a year, will just blow away what we're talking about today.
Can you imagine if we can not just take care of injuries and diseases, but actually even prolong healthy, functional life?
This is revolutionizing medicine as we know it.
So, super powerful. Become part of the movement. Get on the mailing list so that I can send you a copy of our documentary series. I'm Dr. Tami. Just email us at support@drtami.com and you will get a copy of the full documentary series so that you can share it with anyone and everyone you know. It's time to take our health back. I hope you'll join us.
Most definitely. Does anyone have any questions at all?
Yeah.
Dr. Tami, are you having many children like with Asperger's syndrome or autism come into your clinic? I'm asking because I have a son who has Asperger's syndrome, and I don't know, just kind of heard that stem cell therapy may be the answer to helping these children.
So we have a ton of data on stroke, traumatic brain injury, heart, lung, autoimmune, orthopedic, MS, Parkinson's, ALS. We have less on Asperger's and autism, though it does appear that it is helping. It's helping patients with cerebral palsy, dementia, Alzheimer's. So it's a brain thing, and it treats the brain well. So the answer is we don't have anything in medicine that works 100% of the time for 100% of the people, and this is not any different. We're not making any, crazy claims that we're going to fix every condition on the planet for every person. But there is a chance that it can work, and in our clinical trial, we've treated over 7,000 patients, and there has never been one adverse event. So the worst case scenario is that it has not worked. Now, it is funded by patients because there's no pharmaceutical company behind it. So it's a talk that you have with the doctor, the stem cell doctor, and decide whether the age of the patient is appropriate to undergo that procedure, whether they understand it, and what the risks and benefits are that you understand. So the answer is maybe.
Okay.
Yeah.
And if I could ask one more question.
Of course.
How affordable is it? So say someone just, has a disease, or they want to try it, they come to your facility. What's the starting point?
Well, how affordable is it is an interesting question, because we have people who mortgage their home to do it because their health is everything. You know, there's a saying that says that a healthy person has many dreams, an unhealthy person has one. So unfortunately, it's not super inexpensive though, because there's no pharmaceutical company paying for this. The first computer was expensive, the first calculator was expensive, but there's financing options, there's payment plans, and there's different options. So, and there's other options sort of down the road where we can activate people's stem cells. We have a program where we are using nutrition and supplements to activate stem cells. So it's not just an all or nothing. So yeah, definitely follow up and see what we can customize to fit everything, because our pocketbook is part of how we make decisions.
And
yeah.
Dr. Ken, we have an online question coming in from,
awesome.
I'm going to assume Miss or Mrs. Wheeler. And this is personal to me as well, for kind of the opposite spectrum of her question, but she says, can you ask if it works with major depression? And I'll ask my own question, can it also work to maybe treat people that experience mania?
Well, I just treated a patient with bipolar.
Oh, interesting.
So there's that, depression and mania, and they report, you know, this is a case study, this isn't a big clinical, you know, lots and lots of different statistics. They do report an improvement and a stabilization. However, we do not have any statistics about depression or mania or even bipolar. So this patient decided to do it knowing full well that I couldn't say whether it would or wouldn't work. But they were willing to invest in this opportunity because it does heal the brain in so many cases, and there were no downsides because people are sick of taking drugs.
Most definitely.
Yeah, Matei suggests maybe a future Q&A session with you live would be awesome.
That, I would love that. I think that part of my job is to be a librarian. You know, the root word of doctor is from Latin, and it means teacher. So that's what I'm supposed to do. I'm supposed to teach and inform and hopefully inspire people that they can take their health back and they can be the CEO of their own health, especially when you use things like an amazing documentary series that's free. I mean, we need your help. I hope you reach out. Yeah.
This spondylitis, for instance.
Right, ankylosing spondylitis, yeah. So every condition, when we're part of a clinical trial, we actually have statistics. So it's 85% successful if somebody's been told they have to have a knee replacement surgery. It's 85% of the time that person doesn't have to have a knee replacement surgery. So each condition has its own success rate. Autoimmune is big. So MS is autoimmune. It has a 70.5% success rate. Other conditions like diabetes have a 60% success rate. So it really depends. Hashimoto's is another autoimmune condition. It's not as well treated. But sometimes when there's no downside that we've seen in 7,000 cases, these statistics are far more successful than medication or surgery many of the times.
Just one more follow-up online from Kumar.
Yes.
Do you have a foundation, or are you a charity? Like, is there a cause where people could donate related to this research?
So we the charity is out of my heart. I have many celebrity patients who choose to pay for an extra treatment.
And are any of them former athletes?
Yes.
Okay.
And some of the celebrities are big in the self-help world, and what we do is we treat military vets for free.
Oh, okay.
Wow. So we, my husband and I, support Union Gospel Mission, and what we learned is that many of the people on the streets are our vets. There's something cosmically wrong about that.
Yeah.
That we've given up on them when they gave everything for us. And it's a lot of the times because of an IED and their brain injury. And when your brain doesn't work, nothing works, right?
Yeah.
And stem cells are amazing for treating brains. So we treat the vets, and when we successfully treat a vet, we treat a family, and the family becomes whole. And when you treat a family, a community becomes whole. And so it keeps going.
That's right. Well, I also wanted just to say a few things. First of all, is this the first stem cell documentary? Because I'm big into documentaries, and I think that was very high quality right there. Is this the first stem cell documentary? I mean, first the best one that you've seen?
Yeah, well, is it because we
a little biased?
Yeah, exactly. I am very, very biased. Jeff Hayes is a good friend of mine. I've been involved in a number of his documentary series. This is the first one that I'm also involved behind the scenes and owning the promotion and the just, owning getting this out there and becoming part of the documentary series. I am one of the interviews, but we have every expert that we could find across the nation. It's not about promoting my stem cell clinic.
Okay.
It's about getting the word out there. We really want it to be truly a documentary about learning on pharmaceutical drugs that have, side effects for which you're given another pharmaceutical drug.
Yeah.
It's about options, and it's about becoming the CEO of your own life. So how fun to do it by offering a free documentary series that really is like a movie.
Definitely. And I also wanted to say I've shot stem cells. I've been working with you now this year, and I've shot stem cells in 3 different locations, from Dominican Republic to Washington, D.C. to your clinic a few times out to Seattle. And I just want to say that your clinic is the nicest by a long shot. I mean, I have been, in the Dominican Republic surrounded by kids with autism and their families. These people are getting, like, in one room, and here I am getting stem cells with, kids, families that have 3 autistic kids of their own, and they say sometimes this autism can come from the flu shot, the shots and stuff like that.
Some controversy about that for sure.
Most definitely, and I just want to say, like, I've been open about, like, what I've my issue that I've been dealing with. I was diagnosed with an early onset dementia situation, and I hid this from people for a really long time, like it was. And what's been exciting is we've been doing brain scans actually over at Dr. Amen Clinic, which you actually work with down there.
Which, by the way, if you want to know what's going on in your brain, how can you know without looking?
AmenClinics.com.
Yeah.
That's what it is. But from these last scans that we just did, you want to make a little comment about that at all?
Oh my gosh. So I love when people tell me that they feel better and that they don't need to have a surgery. But the doctor in me just goes berserk crazy when I can see something that is to their 2nd and 3rd appointments.
We lost that because I had a call coming in. This phone is. Can you kind of rewind 1 minute? This phone is.
Yeah.
Go ahead.
No worries. So we were
ahead.
talking about your imaging and how I love when people feel better, but it's even more exciting when you have something concrete. So your images are jaw-dropping. The before and after, and seeing the improvement.
Over the course of just 3 to 4 months, too, because I'm doing this every single month. I'm shooting how many stem cells with you? 20 million?
Yep, 10 to 20 million.
10 to here, and then 10 in my spine.
Lumbar, yeah.
Is it with the needle?
Yeah.
Yeah. But I put lots of love in it.
This is, you call it, is a spinal tap, or you call this a lumbar puncture. And I just want to say that it doesn't hurt, like, at all. I mean, it's equivalent to getting, like, almost acupuncture is what it felt like to me. Like, I just, 2 shots like that, and just was painless. So.
But I love the data.
How often do you have to do it?
I do it every single month.
It depends on your condition. There's a different protocol. But I love data. We have cardiac transplant patients who got too healthy and were taken off the heart transplant list. I have MS patients who come to their 2nd and 3rd treatments out of their wheelchair. I have a patient with stroke who's talking in full sentences. He got rid of his glasses and is wearing, readers because his vision came back, and got rid of 13 medications. It's just amazing. It feels like Star Trek medicine. And of course, it doesn't work 100% of the time for 100% of people. I'm not trying to have, sort of a panacea snake oil. But if it could transform your life and you didn't have to worry about the side effects, how amazing would that be?
And Dr. Tami, this is the first time I'm open about my mania issues, and you made me remember my uncle that died from MS, and he was a hospital administrator in the 90s, and he fought tooth and nail for 10 years, and he didn't make it. But they learned a lot from how he fought with all that medical data, and now we're at a time where there's another chance to wake those people back
the
up?
FDA in 2017 approved a new MS drug. $65,000 per year is what it costs.
Wow.
And yet, we have a 70.5% success rate in getting MS patients to get their life back and their independence back.
So do you pull the stem cells and put them somewhere else? Is that what?
Yeah, your fat has hundreds of times. Yeah, nobody minds giving up a little love handle fat. So there's amnion cells, there's cord cells. Turns out that your fat has the highest concentration, and there's no foreign part to it. So I'm very biased. That's my preferred type of stem cell, but the documentary series is there to learn.
By the way, Merle Burks thanks you for educating. It seems like he's a former vet because he really likes how they're helping the vets, and God bless.
Yeah, we need to help all of us.
I think we should talk about stem cell coin really briefly here in the project. So this project is just amazing how I found you locally, and then we came up with this idea actually being the world's first cryptocurrency actually backed by your own DNA on the blockchain and decentralizing, meaning that we're putting in 2 different locations in 2 cryogenics labs worldwide is the goal here. Okay, and we discussed this a little about our party last night and stuff about stems. That was a lot of fun last night.
Yes, thank you for the party.
Yeah, and just what we're doing to bring this mainstream so we can actually take the cost of stem cell medicine way down.
That's the goal.
And this could be, if you guys out there in Facebook land know any stem cell clinics and stuff like that, please put them in touch with me, because we're creating a network as this coin can actually work through all the different stem cell clinics. Also, we're still going over the ideas and the concepts of how this coin can
it's at the
work
early
together.
stages. It's really exciting, but it is so wonderful for you to be able to share this. And my passion right now is this documentary series, and that can lead to all these things. And we'll keep in touch with you about how quickly this amazing form of medicine is changing and all the opportunities that are downstream from it for you to have more independence and control in your own life.
Yeah, Manny Hernandez agrees that it's just so expensive and
it
referring
really
to disease.
is. Yeah, it is.
Fat cells?
Yeah.
Okay.
That way there's no rejection.
And then where do you put them?
It depends on the condition.
Okay.
Yeah.
I'm ready.
It's customized.
But it should be just ones for prevention.
That is what everybody should do. Don't you all wish we could have stored our old, our own cord blood back in the day? But I'm too old. That didn't exist. But you can bank your cells right now. Your stem cells today are as young as they're going to be. And
Dr.
tomorrow
Tami,
they're older.
We're coming up on that noon, high noon right now. Do we have any, how can people get a hold of you?
Support at drtami.com. I'll give you the documentary series. Support at DRTAMI, and then just spread it anywhere you can think of. It's a free movie. So there's no downside to helping spread the word.
It's DR, it's 1 M, it's 1 I. We are about to finish going live.
That's good. Thank you guys for watching this and help us spread the word for sure, okay?
Thank you.
Thanks, everyone.
Nice job, brother. You're good. Interesting.